Welcome to the HIPAA compliance training by Cottage Home Care Services. As caregivers, coordinators, and healthcare staff, we serve people from diverse backgrounds who place their trust in us every day. That trust must never be broken. HIPAA, the Health Insurance Portability and Accountability Act, was enacted to ensure that the personal and medical information of those we serve is kept private, secure, and respected. In this training, we will explore HIPAA's rules, how to comply, and what it means to our day-to-day responsibilities. HIPAA was passed by Congress in 1996. While its original purpose was to help individuals keep health insurance coverage, it has grown to include strict privacy and security standards for all personal health information. These standards protect information in every format, whether it's a paper chart, a digital form, or a conversation. The two core elements we'll focus on today are the HIPAA privacy rule and the HIPAA security rule. These rules apply to every healthcare organization, including ours, and govern how we handle, store, share, and dispose of health data. PHI stands for Protected Health Information. It refers to any piece of information that can identify a patient and relates to their health or care. That includes names, dates of birth, addresses, medical records, diagnoses, phone numbers, email addresses, and even photographs or voice messages. PHI can be spoken, written, or digital. It can appear in forms, charts, emails, or voicemails. Whether you're a field caregiver, office coordinator, or vendor, you must protect PHI in every form. Even simple mistakes can lead to major HIPAA violations. Leaving medical records in public view, failing to log out of a computer, sharing information about a patient in a casual conversation. Another common mistake is sending PHI through unencrypted emails or messaging apps. Social media is also a growing risk. Sharing photos or anecdotes, even without names, can still violate privacy. Remember, if you wouldn't want your information shared that way, don't do it to someone else. The HIPAA privacy rule sets boundaries on how patient information can be used or disclosed. In general, PHI should only be shared for three purposes: treatment, payment, and healthcare operations. Outside of those, patients must give written consent. They also have rights. They can request access to their records, ask for corrections, and learn who has accessed their data. All patients must receive a Notice of Privacy Practices, or NPP, and we should make a good faith effort to obtain their acknowledgement. While the privacy rule focuses on rights and permissions, the security rule addresses how we physically and technically protect information. This includes three main types of safeguards: administrative safeguards, technical safeguards, physical safeguards. Administrative safeguards are the policies, training, and procedures we follow. Technical safeguards include passwords, encryption, and secure software. Physical safeguards involve securing workstations, files, and mobile devices. It's our shared responsibility to implement safeguards in everyday tasks. That means never leaving screens unlocked, using strong passwords, being mindful of what's said in hallways or public areas. Shred physical documents that are no longer needed. When disposing of digital records, use secure deletion tools. Access PHI only when your role requires it. If someone requests information and you're unsure, consult your supervisor or privacy officer. HIPAA doesn't stop at Cottage Home Care Services. It extends to any third party we work with who has access to PHI. These partners are called business associates. They must sign a business associate agreement, or BAA, that confirms their commitment to HIPAA compliance. This includes consultants, interpreters, billing companies, and IT vendors. Talking about patients outside of the care setting, even without using names, can still be a violation. For example, saying, "My patient on 3rd Street" is enough for someone to identify who you're talking about. These types of breaches often happen during breaks, at home, or in public spaces. We must be vigilant and respectful. If someone asks about a patient, even if they're a family member, verify whether they are authorized before disclosing anything. Posting patient-related content on social media, photos, videos, or stories, is never allowed unless written consent is provided. Even if the post seems innocent, once it's online, it can be shared endlessly. Deleted posts aren't really gone. Screenshotting and sharing by others can create a permanent record of the breach. Working from home or on the go, HIPAA compliance still applies. Use secure Wi-Fi networks or VPNs. Never leave open laptops where others can see the screen. Avoid discussing PHI on speakerphone in shared environments. Print only what is necessary and dispose of printouts in a secure manner. And always sign out when stepping away. Emergencies don't excuse non-compliance. Whether it's a fire, power outage, or cyber attack, there should be a plan in place. Know where to find emergency procedures. Know how to secure PHI quickly. Know who to report incidents to. HIPAA violations are taken seriously. Civil penalties range from $100 to $50,000 per violation. The maximum annual penalty can exceed $1.5 million. Intentional or willful neglect can also result in criminal charges, including jail time. At Cottage Home Care Services, the protection of patient privacy is not optional. It is a legal and ethical obligation. Any violation of HIPAA regulations will result in immediate termination. No warnings, no exceptions. This policy is final and non-negotiable. We expect every team member to uphold the highest standards of confidentiality and compliance without compromise. You are on the front lines. That means access PHI only when required. Never share information without permission, report suspicious behavior, keep systems and devices secure. This is how we maintain compliance and keep trust at the heart of everything we do. Thank you for your attention and commitment. HIPAA is not just a rule book. It's a promise to our patients that we respect and protect their privacy.